And welcome back to MedScore Radio, where we bring you music and the best of medical cases. And let's continue on with case number 5, Cardiovascular. We're looking at the first aid book, case book. A 50-year-old woman presents to a physician with a several-day history of fever, night sweats, and chills, and increasing dyspnea during her regular walks. She also reports having a transient weakness in her left arm approximately 2 weeks ago, which has spontaneously resolved. She denies chest pain, arthralgia, myalgia, or rash. Medical history and family history are unremarkable. Physical examination is notable for a fever of 38 degrees, 104 Fahrenheit, and a heart rate of 90, and respiratory rate of 12 per minute. On cardiac auscultation, a loud split S and a diastolic third heart sound are heard. Rales and increased tactile fremitus are present in both lung fields. So if you're wondering what fremitus is right here. It refers to vibratory tremors that can be felt through the chest by palpation. To assess for tactile fremitus, ask the patient to say 99 or blue moon while the patient is speaking. Palpate the chest from one side to the other. So let's continue on. So what is the most likely diagnosis? Cardiac myxoma of the left atrium. Most myxomas arise from the mural endocardium and measure 1 to 15 centimeters. What condition should be included in the differential diagnosis? Endocarditis. Constitutional symptoms are common with atrial myxomas. However, this patient's transient right arm weakness suggests embolization. Outside you can hear the trash man coming to take trash away in downtown Tokyo. Anyway, we're talking about endocarditis. This combined with fever, chills, and sweats makes infective endocarditis a possibility. Next, vasculitis. A peripheral vasculitis should be considered if the patient has arthralgia, myalgia, or rash, which occur in some patients with myxomas. Polyarteritis nodosa can cause multiple arterial aneurysms. Transient ischemic attack, or TIA. Although not typically associated with constitutional symptoms, transient episodes of weakness or other neurological deficits may be secondary to TIAs caused by carotid artery plaque burden, and carotid ultrasound can exclude this possibility. So this patient's Rales and increased fremitus may represent atelectasis or consolidation at the lung bases. Next, what is the epidemiology of this condition? Primary tumors of the heart are rare. Myxomas account for approximately 50% of benign tumors in the heart. The majority, 75%, are located in the left atrium, although all chambers can be affected. The typical age of onset is 30 to 60 years. Familial occurrences have been reported in approximately 5% of cases via the autosomal dominant transmission. And these are associated with a younger age of presentation and higher rates of reoccurrence. So what complications may result from this condition? Complications from left atrial myxomas can be characterized as follows. First, embolization occurs in 40 to 50% of cases with tumor fragments lodging in distal organs, for example the brain, the heart, or extremities. Infection is rare but may lead to further complications with embolization. And obstruction of the mitral and pulmonary venous orifices may occur, resulting in pulmonary hypertension and right heart failure. Lastly, how can the results of the cardiac examination be explained? Splitting of S1 is accentuated as the tumor is extruded from the mitral orifice. P2 can also be louder if the tumor obstructs the mitral orifice or pulmonary venous return. And the third heart sound is produced by the tumor plopping within the atrium during the diastole.